Welcome to the Wellness Empowerment Project. I'm Trish.
And I'm Julie. We are two nurses exploring holistic healing and wellness practices to empower you to be the leader of your own health.
Join us as we have fun making the weird shit a normal part of your everyday life.
Welcome to the Wellness Empowerment Project. Today, we are speaking with Staycie Francisco. She is a licensed acupuncturist who treats patients at Blue Green Acupuncture and Bodywork and Mend Acupuncture in Baltimore. She specializes in everything from chronic pain to stress and anxiety to cancer. She is fond of scientific research and strives to find a balance between scientific and holistic approaches to healing. She earned a Doctor of Acupuncture with Chinese Herbal Medicine specialization from the Maryland University of Integrative Health. So happy to have you with us today, Staycie. Welcome to the Wellness Empowerment Project.
Great. Thank you for inviting me. I'm happy to be here.
Thank you, Staycie. Baltimore is near and dear to Julie's and my heart. That's where we met.
Oh, wait, are you not in Baltimore?
Are you not right now at this moment?
Okay. All right.
I'm still in Maryland, but I don't work in Baltimore anymore.
Are you down? Okay.
Yeah. But I'd love to start off and ask, what is the connection between Chinese herbal medicine and acupuncture?
What is the connection? Well, they're integrated, like Chinese medicine. There's some schools, like my school in particular, didn't teach it from the beginning. You don't learn herbal medicine along at the same time you're learning acupuncture, and it's a specialization. You do additional classes to get yours. Like I did the doctorate program, then I took 2 years. They were specifically for just studying Chinese medicine. Now you can do them at the same time, but at that point it was a heavy load because the acupuncture program is pretty rigorous. But there's a whole philosophy around Chinese medicine in terms of the different facets of it. And there's a portion that is about self-cultivation. So that would be the Qigong and Tai Chi and learning to understand how to move Qi in your own body. And then there becomes a point where you're not able to regulate it on your own. I think that's when acupuncture is very helpful in helping people to be able to get more embodied in themselves and have more regulations, bringing into homeostasis. They all rely on moving Qi. But then going into Chinese herbal medicine, you can use it for general regulation, but I think herbal medicine for me is more like, it's a different level of getting weekly treatments. You're not getting getting a movement. I would definitely move people to be on herbs. Now you can take herbs at the same time as you're doing acupuncture, but I think herbs obviously are going to integrate in the body in a different way. You're ingesting them, but Qi is going to work on a daily basis because you're taking it. Sometimes you're taking it or formula depending on how you're taking it, because there's also different levels of that too. With herbs, you're either getting it from raw herbs where you're either boiling a tincture or you're making the medicine yourself. That's going to have more of the relationship, the integration for you is going to be different. It feels different in your body. And then some people take granules because of the ease. And then there's tinctures and pills. And there are different levels of how that's going to work in your body. Now, I tend to be a purist about that. And also my school was more of a pure. We started with raw herbs. A lot of schools, they give tinctures and granules. A lot of schools don't do raw herbs anymore, which is why I appreciated my herb program, because they started us off from the beginning of understanding how raw herbs work in the body and the beauty of it. It's such a deeper level, and it's like poetry. When you get and understand how each herb works, when you get it the right formula, it's just amazing to see the effects that it has on you. So I prefer doing raw herbs. But of course, when you're working with people who have chronic illnesses and they're tired or they have chronic fatigue, having them make a formula is just maybe one more step that is too much for them to handle. And I can speak for myself from a personal relationship with this. When my mother, after my parents died, I was given a raw herb formula. I went to see a practitioner through the school. and I was given a raw herb formula, and I honestly just didn't have the energy to even make the formula. I never made it. It's because I was so in a, and I think that's what I'm saying. People who are depressed or people who don't have the energy. So I can understand and I can sympathize with people or empathize with people who are in that position that I was, where it's like they're just not going to make the formula because they don't have the time. That's where granules will work. But I try to encourage, once I get a patient back on feeling more energized, I'll be like, would you like to try to do a raw herb formula? And we'll see how it works. Sorry, I went off on a little tangent there, but I love herbs. Actually, it's the reason I went to acupuncture school in the first place, was because of my connection and love of herbs.
So tell us a little bit more about that journey where herbs led you to acupuncture, because in my mind, the two don't necessarily go together.
Yes. Okay. I had started, I have a very varied career, so I'm not going to go into my background. But when I was doing community development for the state, I would do a lot of help communities with building community gardens. I started to get interested in plants. And then I would do a lot of composting workshops and plant workshops around the state. I ended up getting connected with a group called Wild Ginger Herb Center out in Southern Maryland, and they would have a gathering every year. And that's, you would just learn more from a Western standpoint about herbs. And I did a number of programs with Molly. That is where my love of herbs came from. But then once I started studying a little bit more into each herb, I really want to learn how to, I wanted to go to a program for it that was more like get a license, but there is no license for Western herbs. I had been getting acupuncture at that time, and I just stumbled onto it like MUIH. I had no idea the school was actually in Maryland. I had no connection to it at all. So I was like, you know what? I'll do this doctorate program, and then I can take this herbs and I can start learning more about herbs. I literally had, it was so funny. I had no interest in acupuncture to be an acupuncturist.
I love how you're like, I'll just take a doctorate.
Yeah,
It'll take me a couple weeks.
I knew it was a commitment, but I literally was not. That's why I always say I was very like getting acupuncture really opened my eyes to, wow, this is very powerful. Just learning the basics. Everything happens for a reason. So there's a reason that I went there. There was a reason why I was forced to take acupuncture first and then herbs. But by the time I got to the herbs, it all came together like perfectly.
So you didn't
Yeah.
necessarily say, I'm going to go to acupuncture school because I want to end up diving into herbs. That wasn't necessarily your thought process.
No, it was my thought process.
It was your thought process. Okay. You're like,
Yes.
I want to do acupuncture just so I can get to the herbs.
Yes.
That's fascinating. So you said in the beginning that it's all tied in to this Chinese philosophy that focuses on the movement of the qi. Do you mind telling our audience, what is qi? How do you move it? How do you know it's not moving?
Yes. Okay. So I always, when I give an intake or when I'm seeing a patient that I've never seen before, I always give them my intro spiel, because I think there's a lot of misconceptions about what acupuncture is, because it is a branch of energy medicine. Even though Western it's obviously been integrated over the years into TMC, like traditional Chinese medicine, is an integration of Western medicine and Chinese medicine that happened when the revolution happened in China. They created traditional Chinese medicine because of that. And
Oh,
so it
no,
already has a Western
tell
element.
us more about that, because I don't think we know what we know about how that emerged. So
Well,
I
I
would
mean,
love to hear more about that too.
I can't really go too much into the history because I just know basics. There's aspects of Chinese medicine that are esoteric. So when the revolution happened, there was a streamlining, because there's a part of Chinese medicine that is connected to Taoism or the different philosophies. When they were stripping away some of the religious philosophies and they wanted to make it uniform, some of that stuff. This is why J.R. Worsley, when he's connected with MUIH. When J.R. Worsley went to study Chinese medicine, he couldn't go to China. At that time, you learn Chinese medicine like in Korea in Japan, in Taiwan, but you weren't really studying. They weren't really, I don't think they were allowed to. Was the history we were told. There's a level, some of that more esoteric energy kind of medicine is in offshoots of traditional Chinese medicine. Now, traditional Chinese medicine, I have grown to appreciate it. Machocha is one of my favorite authors, and they're basically like foundational textbooks, but they're fascinating. You learn so much from them. But there is also the esoteric philosophy behind Chinese medicine. I know I went off on a little rant, so I'm going to go back to the qi, but they all stem from the principles of yin and yang, right? Yin being the more substantive, material, like things in the world, and then yang being the not. So in your body, yin would be like your blood, your tissues, your bone, down to your cells. So it's like the things that we can see and that we can see visibly and or touch. And then yang is the things that we can't see. So yang is the why your heart beats, why your blood pumps, why you are animated and alive would be considered qi. It's the animation of life. It's the vitality of life. And we use more using needles, we're trying to engage with qi in the body, which is a yang element, and you can't see it, to move the yin or to balance the yin, to regulate the yin and the yang within the person's body. So that's how I approach it from the Chinese medicine standpoint. And that's how you're looking at it when you're doing any kind of physical manual manipulation, even if you're doing cups or you're doing gua sha, you are trying to engage with it. That helps people understand a little bit more about what we're doing, because sometimes patients will come in and they'll be like, can you just cup me? Or can you just work on this knee here? And we can actually move that. It depends on, we have to diagnose, feeling the pulse, looking at the tongue, talking to the patient, and getting a better sense of what is the dynamic of yin and yang in the patient's body. What's the energy? What am I seeing? Then I will decide like how to approach this person. Am I going to give them a treatment where I'm trying to build yin, or I'm trying to move qi, or I'm trying to build qi? And sometimes you're doing both, but you're trying to obviously regulate and bring the body into homeostasis. Usually just by doing that, you're resetting, people get relief if they have pain, or if their menstruation is not regulated, or they have emotional dysregulation, or they're upset, or they have a lot of grief. We can help relieve that by figuring out which channels are involved and how we can help move that. I hope that helps.
Can you talk to us about these channels?
The channels,
Yeah, what are the channels? Where are the channels? How does that work?
there's 12 classic channel foundation channels, and then there are 8 extraordinary channels, and the channels have different levels. So there's the yuan level, which is like what we call the source level, and there's the blood level, and there's the yin level, and there's the yin level. So there's the kind of protected layer body level. We're engaging at different levels depending on what the patient is needing to move. But most of the time when you're dealing with chronic illness, you're going to be dealing more on a deeper level of issues that happen. I've been reading a book on autoimmune disease. It's called Treating Autoimmune Disease with Chinese Medicine. It's a great book. I have it open right now on my computer. And he talks about like how we're all just in general in life. And you can see this, and I explain this to people all the time in terms of when they're coming in for pain. We're in a natural state from when you come into the world, you're born with a lot of babies are so supple, right? They have all this yin, and they have a lot of vitality because they have lots of yin and yang. As we grow older, as we age, we start to get the yin starts to decline, because then when you look at someone who's young and then you look at someone who's an elderly or older, you can see it in the face, the flesh. There's no suppleness in the flesh. Things start to deteriorate. We're on the decline. And that is a natural part of life. It's accepting that we're moving more towards a yang state, an energy state. You're moving towards being non-form. It makes sense that we're going to have some of this deterioration. Now, there's things you can do in terms of gongfa, which is self-cultivation, living, right? So how to use and access, or you're giving a certain amount in your life of energy and chi and how to use what you have, use your resources well so that you can age. A lot of times I think in our culture, we tend to, the motto is work hard, burn hard, play hard, and all those things you're burning your yin at a faster rate. I think that's where autoimmune diseases come from because it's based on this theory from disease for Chinese medicine. You're burning it at a natural disease is considered like cancer. We see those more often. It's like cancer, dementia, Alzheimer's, like osteoporosis, all of these other things, arthritis. But when you start to see young people developing autoimmune conditions in their 30s, it's possibly because there's maybe some genetic thing going on too. When I'm talking with patients, I find that they're working 60, 70 hours a week. They're exercising all the time, or or they have manual labor jobs where they're working their body down to the bone. You can see the pattern. And I can speak for this because I had an autoimmune disease also. And I used to work like 60, 70, 80 hours a week, was never sleeping, was doing everything. They used to joke at when I worked in politics for a labor union, they'd be like, you're burning the candle on both ends. That was my normal. I used to work all the time. And it was not surprising that I developed an autoimmune disease. But that slowed me down for sure. That kind of set me on my path to discovering alternative health, to try to stave off the decline, to replenish myself. Hope that gives you a little bit more insight.
No, that's actually very fascinating. I think we did another podcast guest say that the body does not reject itself, which is the Western thought process with autoimmune, that the body's now fighting itself. And they were
Right.
saying, no, the body does not fight itself. But I love that your perspective is you are essentially burning up your chi, you're burning up your vitality. And I think you saw Julie and I were nodding our heads because we've both been there,
Oh,
burning the
yeah.
candle at both ends, working those 60+ hour weeks and not sleeping. And we may not have gotten an autoimmune disease from it, but we've had other, we'll say, side effects
Right. Yeah. Yeah.
that came across that. You mentioned in the beginning that when you're working with the patients, you're looking at the tongue and you're checking their pulse. What is coming through, or what are you getting from the tongue and the pulse? And how is that linked to the channels that you were talking about?
The the tongue and the pulse, it's going to be complicated to explain Chinese medicine very thoroughly in maybe a 30, I don't know how long this podcast is. But what we're looking for, I'm going to try to simplify it because people get caught up in the organ systems. And when we talk about organ systems, because each channel is connected to an organ system. So it's like the heart. I'll go from the beginning. So I guess it's the lung, the large intestine, the stomach, the spleen, which is like the spleen pancreas, because I've had Western medicine doctors go, the spleen is not in control of that. We're like, yeah, I know it's the pancreas. There's the pancreas and the spleen are connected in Chinese medicine. And then it's the heart, the small intestine, the bladder, it's the kidney, and then the pericardium, the triple energizer, which is triple energizers hard to describe, but it's called sanjiao also in Chinese medicine. I'll explain about that later. It's like the waterways in some ways. So it's the triple energizer, and then it goes to the gallbladder and then the liver. That's it. Those are where they end. But sometimes you're looking at it from the 12, or you're looking at them from which they're categorized in 5, which would be it's the lung, the water, the wood, the fire, and the earth. We're going from that point. The metal would be the lung and the large intestine. The water would be the kidney and the bladder. The wood would be the liver and the gallbladder. The fire would be, it's actually 4. So it's the heart, the small intestine, the pericardium, and the triple energizer or sanjiao. And then the earth would be the stomach, spleen, or spleen/pancreas. Sometimes we're looking at from the 5, and those 5 present in different ways. With the metal, it would be like, it's going to be energetics that are connected to those organ systems. It's like people who have a low voice, right? They speak very low. they don't have the oxygen, right, to speak high or talk high, or they're affected by a lot of vitality. But also there's other things in terms of maybe they're sick all the time. They are constantly getting colds. So we're listening for that when we're doing intakes. Then the large intestine, obviously, there's going to be colon issues, bowel issues, right? There's digestion issues are on the lower end. And maybe there's some other characteristics we're looking or that have to do with the skin too. How maybe people are having allergies, they're prone to allergies, maybe they have a lot of breakouts or hives. And so that would give us a little idea. Maybe I should be checking out and seeing how those channels are doing. Then there's emotions too that are connected with those that come up. Now, most people would probably be like, is this true? When you're doing intakes and you start to see the patterns that come up and they start to align. If someone is having a lot of fear or they have a lot of anger, it's like anger is under the wood. So there's an emotional component. Mental is like grief. There's a lot of grief, some depression, some sadness. But we're looking for those when we're listening to the patient. And it gives you kind of an indication. You're getting everything and filtering it down. And then when you come down to palpate on the pulses, each of those channels we can connect with on the pulses because we're reading for the 12 channels when we're reading on the hands. On the left side, you're going to have the heart, the liver, and the kidney, along with the small intestine. We're considered yang. Channels are also on those. They're counterparts. And then on the right side, it's going to be the lung, the spleen, pancreas, and the pericardium, and then along with their yang partner channels. And so we're touching those to feel what we're feeling in terms of how much chi there is there vitality, is there any stuckness, and it just gives us information. And when we look on the tongue, actually has also confirms more like if there's something happening with the lung area, there's different areas of the tongue that it signify what could be going on in the system. So that's how we diagnose and look at things. Yeah. And then it's a matter of you're palpating the person, palpating along the channels. And usually you're going to find those channels that they're talking about. There's confirmation because when we touch them, either they're tender or we know, oh, this is a place where we're going to be working on. I hope that helps.
So
Explain it.
it sounds like you take a detailed history and
Yes.
then you start to do a physical assessment, which
Mhm.
involves looking at the person's tongue, then their pulse points. And then from there, how do you develop a treatment plan? Because you offer acupuncture, you have herbs. Sounds like you also do some cupping. So,
Mhm.
how do you take all of that information and figure out, okay, what can I do for this person or how do I treat this person?
There's different ways of approaching treatment. A patient will come in, it depends on what they're coming in for. There's going to be different practitioners who have different approaches to this because everyone has a different strategy, but my strategy generally is this. I like to see first if the patient is going to respond, if they're going to respond to chi, if their chi is going to respond to a treatment, period. So I usually stick with some of the just like the general bringing the body back into homeostasis. Wanting to check and see if this is going to regulate them, regulate the patient. And a lot of times people will come in and they'll say, oh, I have like my back, this is killing me, and blah, blah, blah. And then I do some of these just general regulating treatments, which is not necessarily addressing their complaint in particular. And they feel great afterwards because it's like just bringing them into homeostasis actually relieved their gave them some sort of relief. That tells me a little bit more. It's okay. So there's not really, it's more like bringing them into regulation and then helping to, if there's a yin deficiency, then I'm going to tonify after that. I'm going to do the protocols. I'm going to test and see how their chi reacts. And if they respond, because sometimes people don't respond to acupuncture, and then I'm going to know a little bit more. If those treatments don't work, I generally am like, okay, if this is a patient who's more on a body level, on a mental level, or on a spiritual level. Some people are going to come in, they're either always in their head, they need to think about if these things are working. This is the person who might come in and they're very into their diagnosis, attached to their diagnosis, or in the body where it's like they're more into physical touch. They have to feel the things happening to them. Someone who might be more on a spirit level can feel chi faster, right? They're going to feel the chi. Everyone's different, right? And some people can feel all of that. Usually, what I'll do is kind of gauge, is this person going to be more of a physical person? So they're going to probably respond to more manual therapies, doing gua sha or more stimulating needling is going to be something a physical person is going to respond more to. Or even sometimes I do zero balancing. I do zero balancing, which is, okay, I don't know, it's can of worms, but anyway, opening it. But it's Fritz, the person who started zero balancing actually studied at MUIH. He was a chiropractor and osteopathic surgeon who developed this kind of thing where you're doing energy through the bones instead of using needle. And some people respond very well to that because they need to have that bone, the physical level, even though it's a gentle physical level. It's not like massage. That is going to be, they need the kind of the weight of it. And I just had a patient that I've been working with lower back pain. Nothing was working. I was getting ready to put this first patient on herbs. And I was like, I'm just going to guess because they told me a story about they had pain when they were working out and the teacher did some manual stretches on them. And that was the key. I was like, this patient probably needs more manual work. And I was like, let's try zero balancing. Her pain went from 8 out of 10 to a 4 out of 10. And we've been working together for months. I was like, wow, okay, so this is really going to work. So you just have to open up and see what's going to help the patient more. It's good to have a little bag of different things you can bring out.
I really appreciated hearing you share that story and how that it really wasn't this, oh, you have this problem and this is the solution. It was more of, you have this problem, these are possible solutions, and there's one that may work best based upon the way that you are digesting information. Are you like a physical person, emotional person, spiritual person, almost like this mix of like personality type or how you're presenting?
Right.
And I love how it really shows that you get to know your patient on a very different level to help
Yes.
figure out what will work best. And I find that absolutely fascinating. I want to quickly go back because you mentioned about sometimes the acupuncture you use to try to bring the body or the chi back into homeostasis. If you bring it back into homeostasis, let's say in a treatment or two, do you know if it's going to, for lack of a better word, is it going to stick? Or do we have to do this repeatedly? And how does that work? Because I start to wonder, oh gosh, do you just end up going to acupuncture forever, just like you do all these other things forever? Or is it something like you can reach a point where you are able to maintain more of your natural homeostasis?
No, I think that's the crux of it. And I think that this is where treatment planning and working with the patient to be like, okay, usually most patients I'm going to see, I'm going to be like, let's do 4 treatments and let's see, because I want to see how your chi works. See if you respond to treatment. We're going to do like just straight treatment will be the first one just to bring it home. And then I'll probably work into maybe some more manual therapy that's called for and see if we can get some movement. And then as soon as a patient starts to feel better, we're going to stretch out those appointments, right? It's maybe you should be coming in every 2 weeks. Let's see how your body can regulate with 2 weeks, having 2 weeks out. And then you keep going further until you get to maybe a month out. And maybe they're coming in quarterly and then they're coming in only when they need it. Some people can go to acupuncture, and I have been that person, I'll tell you. When you're just going in for like emotional regulation, or just, I used to love going for deeper spiritual work, especially around like trauma or something like helping you to get out of your head, stay connected with your body. If you're like, I'm a person that tended to be like, my mind was 10 feet ahead of or maybe 2 blocks, 3 blocks down ahead of my body. Acupuncture was always nice to help remind me to stay in my body. I think you can get to a point where you almost like it becomes a little bit of a crutch for people. And as a practitioner, that's what I'm saying. As a patient, I was not this person, but as a practitioner, I try to encourage patients to about their agency over their own health. When I bring in new patients, I always talk about this is your chi. They might not at that point believe they have control over their own like bringing their body back into homeostasis, but I work to help get them to that point. That's my goal every time. I want them to see that they can do it. And how we get there, every person's going to come in from a different standpoint of like, being able to get to that. I get that as from being a patient too. How can you regulate yourself? It becomes that thing. Some patients who have I know this is going to be, I'm going to bring up a book. Okay. What is, it's You Are Not, You Are the Placebo. Have you read that book? Okay, he's a little bit, some of these writers sometimes, I'm not saying any, but is that I like a lot of the stuff that's in the book about, because there is a level of mind over matter. And I'm not saying that there's all people can, like, obviously you can't talk to someone who's been in pain for 10 years and tell them there's mind over matter. But I do believe in I wouldn't be doing energy work if I didn't believe that you can use your energy to change the dynamics in your own body to a certain degree, to gain health, to be able to regulate things. And so when if they can't feel the tree, I want them to get to the point where they can feel it. When you have someone on the table and they feel it for the first time, it's such an amazing experience to observe someone who may be somewhat disconnected and or more physical, or either disconnected from body, mind, spirit level, or they're more in their head. So they can't really feel, and encouraging them, they start to feel the chi. It's great. But of course, we're always there to help.
Are there certain things that you recommend that people start putting certain practices in their lifestyle that may help them with not requiring treatments all the time and to maintain that homeostasis?
We're talking about like stress, anxiety, anger. Oh, and I love working with people who have anger, but who have a lot of anger, because especially the one I really love is people who repress their anger. Because when you see how that physical manifestation in the body, I think it has so many health implications. They already talk about that. I've read a couple of reports on, especially women who repress anger, how it affects your heart, how it affects your high blood pressure, how it affects like your cardiac health. We talked about how there's emotional connection with each of these five elements. When you think about that, that is one of the things, regulating, finding a way to, one, get connected with your emotions, and so that you're not suppressing them. And people always get a little bit iffy when I tell them to be angry. I'm like, if you're angry, be angry. Find a way though to do it in a healthy way. You got to find a healthy outlet. When I used to teach yoga and I was in school, I would get a lot of frustration. I would come, and I told people before I taught my class, I would go there was a back closet and there was a kickboxing bag, and I would go in there and kick that bag for 30 minutes before I taught class, because I had a lot of aggression to get out. And I was like, this is the way to do it. And also shouting in the car or like flying in the car. You have a lot of grief and you don't feel like you can accurately express it. You can do a lot of things when you're alone in your car. So getting those kind of things, I think that moving the emotion is very helpful to on a surface level. And then there's also movements you can do. I always suggest people do Qigong. Qigong is a great option for people, and it's free. There's tons of YouTubers, like Damo Mitchell has YouTube videos, and there's a couple of other. If you want to learn to go deeper in it, but if you're wanting to learn for something, you can move Qi through just walking or a basic movement. I think there definitely is a part of the learning. This is why I think when you're working with a practitioner who's working with you to make those connections between the different aspects of the five elements and the channels, people get stuck on the channels because it's something they can relate to. And it's something like, oh, my spleen is my spleen chi is deficient. What can I do? But they get caught on the spleen. Don't worry about the spleen. Let's talk about, do you worry a lot? Are you ruminating all the time? Are you a mental person? Are you constantly ruminating in your head? Worry wart, catastrophizing. Let's talk about what we can do to practice and bring some calm to your mind. That's going to have a huge effect on your digestion. It's going to have an effect on your health and other implications. The chi you come into the world with, right? It's called Heavenly. Great podcast. Also, there's a podcast from New Zealand called Heavenly Chi. You should listen to that. There's what we have is called post Heavenly Chi. Post Heavenly Chi is what we get from the self cultivation. A lot of it we get through food and drink and the air we're taking in, how you're eating, like you're feeding yourself. I think a lot of people have very difficult relationships with food. I know I did when I was growing up. And also, like when I was working a lot, I totally cut off I couldn't hear hunger cues for a long time because I was so used to not eating or drinking. And I know nurses do that a lot. Nurses, police officers, anyone who's working a job where they can't take a lot of breaks. Because I used to treat a couple of police officers and they don't drink water because they're afraid they'll have to go to the bathroom during a call. And I was like, are you serious? But true. This is the thing is we're not drinking water, you're not eating, you turn off those hunger cues. And that is a part of you're not getting chi. That's your post-heavenly chi. Where's your body getting, if it's not using the post-heavenly chi, it's tapping into your jing, your life essence, your chi that you were given to come into the world with. You're not replenishing on a certain level. You're just tapping out, making sure you're eating, you're feeding yourself, taking care of yourself and drinking water, like nourishing yourself is a part of how you can cultivate post-heavenly chi.
Stacey, thank you so much for that, especially the end here with that wisdom of how we can cultivate our own chi. Do you mind sharing if anyone listened to this and they would like to explore acupuncture or herbal medicine with you, how could they find you?
My website is staceyfrancisco.com. I also have a link to, so they can see me at my private practice or they can see me at Mend. I'm on the Mend schedule. I tend to do herbs more privately, but I also do herbs at Mend, but it's after I've seen a patient for a while. Private practice, I can spend a little bit more time. That's why my intake is a little bit different on the private side than it is through working in it. But thank you for having me. I hope I was able to answer a few questions that are concerning or interesting for people.
Yes, thank you so much. I'll make sure that we put your ways that people can connect with you in our show notes, just to make it easier for everyone to find you. Thank you so much. Thanks for joining. If you enjoyed this episode, please follow, subscribe, and share with a friend.
Want to learn more about a specific topic? Follow and drop us a line on Instagram so we can explore it more with you.